Hi, my name is Jessica Collins, and I'm a pre-licensed therapist in Miami, Florida, and I'm currently seeing clients in person and in telehealth. One of my favorite things to talk about with mental health is growth. So, a lot of people think that growth, like we see on social media, is this plant in full bloom, but it's not actually like that. So, growth is actually this process of, where we go from that small little seed that's in the ground to something that's actually that full bloom process. But with people in that process and what they see from social media, they tend to think, oh, I need to be right at that point B. And so they're going from point A to point B and not really knowing exactly what that entails. So that's kind of where I come in that mental health journey is learning, like, how do we get from point A to point B? And, if there's messy parts, like, how am I going to be supported in that aspect? So in the mental health healing and journey process, a lot of clients have, kind of come to me telling me that they really want to heal. So sometimes what that looks like, especially with, today's social media, we kind of like post the triumphs of our healing. We don't really know what to do with the losses, right? So you're not going to post like a video of you crying on the internet. So one of the things that I like to really talk about with clients is, what do we do with that process? What exactly does healing look like? And so that's kind of what I'm passionate about and what I help with is, helping clients to see, what exactly do I need to heal from? And what will that look like? How do I do that? Does that entail cutting things out of my life? Or does that entail, trying to figure out what works and what doesn't work? So I specialize in treating mental health challenges and issues such as anxiety, depression, life transitions, trauma and neglect, and self-esteem issues, just to name a few. I like to do this by incorporating techniques like acceptance and commitment therapy, CBT, which is cognitive behavioral therapy, using some other trauma modalities that I know. And I also like to, really talk to my clients and see, what has happened in their past that's really contributed to how they react now. So we also explore maybe some things that they're going through, some different symptoms and, how to manage those symptoms, how to control really difficult emotions and, psychoeducation and insight into, how can I improve now and how can this help my future? So one thing I like to tell my clients in all of my sessions is that, one size fits all really doesn't apply to therapy. So, sometimes I won't be a perfect match for clients and sometimes clients won't be a perfect match for me. So I like to go about that process with open communication and letting my clients know that, hey, even if I'm not the perfect therapist for you, I'm still a support for you and can help you figure out exactly how to find the perfect therapist for you. So that's one thing that I really like to make sure is very clear from the beginning that, regardless of whether or not we continue sessions, I want to help you on your mental health and healing journey and figuring out what will work for you.